Ergophobia, also known as ergophobia or ponophobia, is characterized as an intense, crippling fear related to work. This involves dread of manual and non-manual labor, fear of employment instability, or specific responsibilities in a workplace. This term originates from the Greek words ergon, work, and phobos, fear. Though it doesn't have a specific definition in the DSM-5, ergophobia has aspects that fit into the other specific phobia 300.29 or 40.298 category. It shares similarities with social phobia or performance anxiety, encompassing excessive apprehensions about work and work-based environments. This extends to fears of failure, public speaking, performance anxiety, discomfort in socializing with colleagues, and potential emotional, or physical injuries at the job. Phobias, in a broader sense, are psychological disorders wherein a person manifests excessive, enduring fear that is amplified compared to the actual threat. This emanates from a defensive instinct to constantly evade the fear, instigating element, thus inducing distress. These phobias can either be specific or generalized to social surroundings. Exposure therapy is the most effective treatment used to address them. These phobias are typically linked with other mental conditions like depressive disorders, anxiety disorders, bipolar disorders, substance abuse, and personality disorders. Ergophobia is associated with both physical and psychological symptoms, particularly fear and deliberate evasion of work environments. A study on teacher burnout discovered ergophobia sufferers to show notable worsening on physical health indices in contrast to their peers. Identifiable physical indicators for ergophobia comprise rapid heartbeat, dry mouth, profuse sweating, general discomfort, and panic attacks. Furthermore, symptoms may also manifest as inability to execute work commitments, struggle in job retention, avoidance of additional responsibilities, recurrent negative thought patterns related to work challenges, and alienation from the workplace. The concept of ergophobia remains contentious and has been previously dismissed as laziness. According to some, ergophobia may be a derivative of job burnout, viewed as the aftermath of enduring, unresolved occupational stress. The term burnout came into popular usage in the United States in the 1970s. Burnout symptoms include emotional and physical exhaustion, accompanied with negative outlooks, often stemming from excessive interaction in job roles. It is more prevalent among healthcare professionals, mental health providers, social welfare workers, lawyers, and corporate employees. Let's discuss anxiety disorders, specifically ergophobia, which echoes similar symptoms to generalized anxiety disorder, GAD. GAD patients suffer from excessive and uncontrollable worries about varied issues and experience stress levels that don't align with realistic threats. Mirroring the fears of ergophobic individuals, these anxieties often get triggered by everyday work tasks, evaluations, or presentations. Another significant character in this narrative is social anxiety disorder, or social phobia. Individuals with this condition experience anxiety triggered by social interactions where they feel judged or rejected. This fear intensifies with escalating work-related instances like presentations or social interactions at work. The plot also introduces other specified anxiety disorder, a condition that causes remarkable distress and high anxiety levels. However, it's different from other anxiety disorders as it doesn't significantly represent diagnostic symptoms. This condition severely affects an individual's performance in social or work situations, similar to ergophobia or occupational burnout. Unsurprisingly, ergophobia cases increase as more people work in environments conducive to the syndrome, even though ergophobia rates might remain constant. The transformation in employee dynamics due to the service-based economy evolution is an underlying subplot. Particularly notable is the widespread use of performance appraisal systems to boost employee engagement and productivity, often culminating in emotional exhaustion and ultimately burnout or ergophobia. The narrative also highlights the possible misinterpretation of mental health diagnosis due to the increasing discourse around mental health awareness in Western culture. Awareness in Western culture. The fear of work, a wide-ranging term, might cause people to incorrectly label themselves as ergophobic when they could be dealing with work-related stress or other mental health disorders like GAD or social anxiety disorder.